Thank you, Madam Chair, and I'll try to answer some of the questions very quickly. Appreciate Senator Correa for her long-standing support and for her comments today. As to Dr. Weber, who made some excellent points. One of the points that she made was that she believes it should be passed at the federal level. The ACA waiver process was created so that states could move forward with a variety of programs, including potentially a single-payer program. So it's been set up in a manner for states to take the lead, to be the ones that move forward with it. It's the same way that many other countries, Canada is an example, that started at the state level, and actually each state has their own program that the federal government helps to fund. And so that's the reason why we lead as a state on the policy. One of the questions she raised, also a good one in terms of giving doctors, nurses the autonomy to make that decision. The decisions in the operating room or in the hospital room. Really, the reason why that's in there is that we don't want algorithms to override the best judgments of those that are actually caring for our patients. Now, can we tighten up the language? Because we definitely want it evidence-based, and more than happy to work with Dr. Weber to ensure that language makes it very clear that we still want to make sure that they're using best practices, evidence-based practices. What we don't want to have is some algorithm or what we see nowadays, an insurance company telling a doctor that they can't do what they see as medically fit. In terms of the CalCare board having too much power, look, this bill is the policy bill. And I want to make that very clear. This is the policy bill on how the actual operation of CalCare would function. And as was mentioned earlier, there are many other steps that have to be in place, including the funding of a system that the legislature would have to approve and give authority to and release those funds to the board. So there's plenty of opportunity, and our intention is to have legislative authority through that process. What we don't want to have, and this is that balancing act, is to have every year you have to go back to the legislature to change something, do this, and the other. We need the board, the CalCare board, to be able to operate independently because it is a system that's going to require that level of attention, but it does not remove legislative authority or the relationship between the legislature and the CalCare board, but more than happy to look at language that would better satisfy some of our colleagues if they think there needs to be more language in the policy bill that makes that very clear, that the legislature is not completely cut out of the operation of CalCare board in terms of especially the financing aspect of it. To Senator Patterson, I appreciate his comments. The reality is that when we talk about businesses are being fleeced right now. They're being completely fleeced, and they have very little control over how much they're being charged or how much their rates are going up year over year. If we can relieve them of that obligation, if we can relieve them of that and have them have something that's a fraction of that, which is what would happen under a single payer program, we would actually make it more competitive for businesses to be in California, especially knowing that now they can get rid of all their administrative costs of having to worry about their employees' health care, which is an enormous cost on businesses. And let's keep in mind that Californians right now, including California businesses, are paying the highest healthcare taxes in the world. They're just not called taxes. They're called premiums, and they're called co-pays. They're called administrative costs. So we can play the game of, you're going to be taxed this and the other. Let's be real. We have the most expensive system in the world, and we do not have the best outcomes. To Senator Reginald Jones Sawyer's points of these wait times, and let me tell you this. Now, my father's right there in the front row. I take care of him. He's on Medicare. I take him to his appointments. I know how long it takes to get an appointment. I know how much he pays out of pocket. I know he has to have Medicare Advantage, which was, again, a privatization of our Medicare system. And we're lucky that he can afford to do that. If he can't afford to do it, guess how long his wait time is going to be? Forever. And so I really appreciate the comments from Senator Jones Sawyer. Absolutely, the goal is to make sure everyone has access to high quality care. And the reality is we can do better than Medicare. We can provide long-term care. We can provide vision and dental. My dad has spent $6,000 for hearing aids. He has to pay thousands for dental work. That's a reality of what people are going through, and you're lucky if you're the ones that can afford it. Those are my answers to those questions.